So Dr. Joyce, tell people who you are.
All right, so I'm Dr. Joyce Akwe. I am an internist and I am a professor of medicine. So an internist is a physician who sees the patient first and so diagnoses the patient. So assume that you have a medical condition or you're feeling some aches or you're just feeling something, you know that something is not right. The first doctor you go to will be an internist or your family doctor. Once you go to these doctors, they will easily determine what is going on or who you may need to better care for you. So we will either care for the condition or refer you to someone who has more in-depth knowledge on those conditions or who can perform procedures that we are not able to perform. So we are your go-to doctors for everything, and then we can help direct you.
So you are that kind of person that kind of liaison between the two, right? Because it's important, guys, for if you have a primary care and you have a specialty doctor, a specialist, then the two need to talk to each other, because if they prescribe, both of them prescribing medication, they need to know about that, and it's not something that cancels each other out. Correct?
That is correct. That is correct. The person who is going to coordinate your care will be your primary doctor, and that is the doctor who will refer you to a specialist, and the specialist will also get back in touch with the primary doctor. They will communicate and discuss your health conditions so that they know what to prescribe and what not to prescribe. And usually the primary care doctor knows the patient a little bit more and knows a lot of information that is important to let the specialist know. And so it's very important for the doctors to work together. And again, the person who is going to be coordinating this care is your primary doctor. So you go to your primary doctor, and then even if let's say you go to the cardiologist and you don't understand what the cardiologist said, or you've forgotten some of the things that were said, talk to your primary doctor. They will be able to give you a little bit more information on that, especially if you're not going back to see that specific specialist.
Awesome.